Very good evening to everybody, and welcome to another episode of The Different News. Today, I have a very dear friend of mine, and I'm very happy that I got Dr. Andrea Lorena Basaldi Agendi today from Chile on my podcast. Welcome, Andrea, and thank you so much for accepting my invitation and being on this show. It is a pleasure and a lot of warmth I feel today having you on this podcast.
Thank you very much, Gargi. I'm very happy to be here.
Yeah. So Andrea, I know you from I know you for a long time now. So you have an extensive career, and I really want that journey. You speak about it, and I will I mean, it would be very nice because I think a lot of inspirations comes from the journey that you have already traversed. So my first question to you is, can you share your inspiration in pursuing a career in dentistry and how this has led you to become an expert in healthcare in auditing and management. I mean, in quality auditing and management. So it's something not very common, but yes,
Yes.
we all would like to know about that.
Well, I think I have always since ever this little skill I call that I have a very good perception. And since I was little, I always wanted to be in healthcare because I got the figure of my dad. The figure of that is really important in girls. And he's a very recognized physician in Chile. So I wanted to be a doctor, a medical doctor. And that was inspired me first, at early age. So I worked on that, and I was a lot into illustrations, So that means also that you connect somehow with part of the body and how the body works. And so I studied first medicine 4 years at University of Chile. And then, I developed this quality of perception. And I noticed since very early times, I don't want to say my age. So we're going to do it theoretically. But I noticed that medicine and dentistry were not connected. Yeah, because even the faculties are separated. That was my first talking about years ago. And so when the things with medicine didn't work out for me, not in theory, but in more environment things. So I should switch to dentistry. And in dentistry, to be honest, I did not, never had any inspiration figure. So that was an issue during the career because I was not motivated, to feel inspired, So I started inspiring myself. And in that years of ending the clinical education at the university, I started inspiring in patients' demands. So at the beginning, I was only working as a clinician, but because I was interested in how things were managing, because I noticed most of the claims were because of lack of communication. Not necessarily because the clinician did things bad, it's because he didn't explain what he was going to do. And because the patient did not follow the instructions, because he did not understand what the dentist said, So I said, okay, how do I work out this? Because I'm a clinician, I'm doing endodontics, And then someone suggested me do an MBA. I know an MBA that can give you a more wide look You will not only be centered in dentistry, you will be with people interdisciplinary of health, nurses, physicians. And I would say that was the first door that opened to see a different reality and to be able, because in dentistry, as a dentist you are too, you know that we are very close, you know, like only in dentistry we move between dentists, and it's difficult that you have more conversations only with the nurses when they come to check on you. But yeah, but you don't even understand in that time. I did not understand why they were checking those things, you know.
Right.
And I think that was the beginning. And after that, I developed more interest. That's why I was opening more my mind, and also because somehow it was like a back to the roots for Colin, because of my first career that ended not very well as I wanted. And somehow I go like back again, you know, like a circle back. And then I start with, okay, then I will do something about infections, you know, because it's related, and quality is related with infections. And then also digital health, because now it's like growing all the thing of ChatGPT, regenerative AI, you know. And I said, okay, I need to know more about this if I'm in healthcare, because it's an industry that is moving very fast, you know. So that was basically the first step, I will say.
That's inspiring. I mean, you can study so much. I mean, somebody can study so much. That is the first thing. So I
I'm
think that
curious.
yeah, you are extremely curious. Yes. So as you said right now that you have done, like, you studied endodontics, like the
Mm,
specialty
mm.
thing. So so when you have studied, or when you have worked, in practice, so where do you see this field being evolving, in the years, particularly if we focus on clinical restorative practices?
Yeah, you know, to be honest, like when I was in endodontics, working as an endodontic, I was a little frustrated, I have to say. Because one thing is what you study, and when you're doing the postgrad, my postgrad lasts 2 years and a half. And the thing is, I did it in a university that has a lot of technology, and it was very up in technology. But the reality in working in most clinics, normal clinics, is that that technology is not available. So you and of one thing is like when you study a dentist and then you start working with different conditions, you know, that you were not explained. And that's something like that happened to me. I was a shock, you know. Then I go and start working, and then I notice, oh my God, I have not this, I have not this, that, you know. So it's going to be difficult, but okay, I do it, you know. But at the end, in endodontics, it's always like working as you were blind. And basically that is like, okay, there are people that can do it really well and are confident about, but I was always extremely worried that I was gonna make a sentinel event to the patient, because I did have the sensation I did not have the right technology to do it, you know, and to make a false way, you know, to make a perforation, to make to the timing, because sometimes you were like push it a little bit, okay, do it more quickly, you know, and things like that, and all kind of the things that you have to deal in quickly clinics that I said, not in your own personal setting, you know, that's another history. You manage your times, but when you're in the work market, to say that's the 8% of our dentists here, things are different. And you know, anatomy of molars, especially second molars, is difficult, and it's very changing. So I think that's probably the most challenging tooth to do in dentistry. Probably would be the second up molar, if I don't remember one to do it, a third molar one. So that is that you have to do it, but you have to be like very confident. And I was very too anxious of precautions, and it was always like. Thinking about the patient, I'm gonna harm him or her, that was my thing.
Okay, so yeah, I mean, those are practical things many people face, as you said. Like, it's not that when you study something and you are applying it, and particularly in a clinical scenario, and very rightly, as you said, that when you are working in somebody else's clinic, that's again a big pressure, and you have, as a clinical person, you have to be, you have to be perfect, but that's not possible all the time. Well, I think from that point, when you came into your MBA in health and your training in digital health, digital health, because I think that's something which is very attractive to me as well. So, how these in field of education, because you have acquired this degree, so did it somehow influence the approach that we use to manage healthcare institutions, particularly in the dental sector? Is there influence, you think, of your this kind of a background?
I have to say that in digital dentistry, the only thing we were influenced somehow was the use when appear the digital X-rays, and the softwares to take the X-rays and everything involved, and the CAD CAM software that it was done for doing overlays, onlines, and inlines. That was our approach on digital dentistry. But then when the pandemic came, oh, and maybe before the pandemic, the design of smiles, for orthodontics, and some guided clinic from implantology. But after the pandemic, when telehealth started like an opportunity in medicine, I believe that in dentistry, at least in Latin America, would not take that chance. And I'm still wondering why we didn't. United States took it very well, Australia too, Canada too, some countries of Europe, I believe United Kingdom did. And I'm not sure about in Asia, maybe Japan. I could be lying, but those before I mentioned, I'm pretty sure that they did, and those were the ones that had more high maturity in the score level of digital health. And I think we missed a huge opportunity to involve teledentistry in our education for patients, in our monitoring of chronic patients. As recently someone told me in a webinar that oral health or oral disease is part of non-communicable diseases in WHO. When I ask why or when it's going to be oral health integrated in the body. And I think we miss diagnosis. Okay, some clinics did trigger, with telehealth in medicine, but they did not use that in dentistry. I know that now there is probably one clinic that is using this tool in a web-based page in Chile, but the sentiment or the concept of teledentistry is more deep than that. It's like to actually have the dentist in your home. It's not just a call, like we can do that. And we did that before pandemic, with patients having calls when they had traveled, and we said, okay, send me a picture, and to check whatever. But the concept of teledentistry is more than that. It's like to be able to see the mouth of the patient immediately via camera, via scanning, via intraoral camera, or telemonitoring with biomarkers. It's more than that for me. Or to be able to, for example, exchange X-rays and develop with a program with artificial intelligence to give feedback straight back to the patient directly and fast. And those technologies are available, but not we are not using them as the way as should for public health reasons, as we all know that oral health influence very strongly systemic health.
Yes, yes, right. Well, I think with time, maybe the adoption of newer technologies would increase, and because it's like with the artificial intelligence coming in, and
Mhm.
there are a lot of young minds who are more enthusiastic about these fields. So
Mhm.
as of in India, we see a lot of startups coming in this aspect, particularly involving artificial intelligence and different dental, not treatments, but more into the probably the diagnosis, at least the provisional one. So that's, I think it's a promising time ahead.
Yeah.
Andrea, yeah. So my next question is like, I'm sure that like you work as a quality auditor. So
Yes.
I
So
know that, I think, yeah. So I think as such it is a very challenging position that that you work in. So what are the challenges that you face in this field, particularly if you are trying to ensure the healthcare, I mean the institutions or with whomever you are working, that they meet the accreditation criteria. So what are the challenges that you face?
the challenges, I think, quality, it's very related. I did not measure this before studying it, but it's very related with the human factor. It's very strong, the correlation, because in quality, you not only check indicators and measure things, you also work with people. And to improve, you need the as this very trendy word, the co-production of different interdisciplinary people. Oh, to say it in simple, you need everybody to do the work, but in a good way, you know. And so most of the times, it's like different styles to engage people. Oh, let's be friendly, or let's create this culture. But it has to be something true, because if it's only just a moment or 30 minutes of, oh, let's be all friends, and then after we are all fighting, that is not going to take you anywhere. And also it's in different institutions, I think there is also the fear of being, and nobody likes to be measured in anything. you know it's always a challenge, and it's always like somehow there is before a lot of fear and nervous and anxious. And I think, in my opinion, that accreditations probably in the next times will have to be less more like me evaluating you and you being evaluated. It's more like a monitoring, like how things are developing, and seeing the results, and a less not paperwork thing. I think it's not right now, it's too much paper, and we want to see more outcomes and clinical results that are positive. And I think most of the people would agree with me, especially the ones that are looking more forward, that it could be one of the critics for not only in Chile, just mostly all the quality accreditations that come. There is also a calling for 2030 of how it's going to be the new quality in accreditation. and how it's going to change with IA, because we cannot be naive on that. That is going to change too, That's probably tools for quality management or even for accreditation are going to develop or are just already. And so all the automated work is going to be done by the machine learning, optic learning, and you will have to be there to know how to use and how to evaluate that and control that it's done correctly. So I see a lot of challenge in quality accreditation in the future. And it also, not only in technology, I see challenges in human factor as we need to find a culture in healthcare system where everybody is more empathic with the other one and less competitive, less envy, more supportive, because it's okay to be supportive with the patient when, okay, that is the center. But the healthcare work is also the center too. It's one another pillar. You cannot concentrate only in one. It's a whole. It's the same as healthcare. You cannot concentrate only in the body. You have to concentrate in the mouth. You have to concentrate in the mind. You need to make it more holistic and integrated.
Thank you, Andrea, for explaining this and sharing your insights from your experiences. I think it is very valuable points that you have mentioned here today. Thank you so much for that. Well, so when we are talking about quality and particularly in a clinical scenario, and when we are specifically focusing on dentistry, infection control or infections associated with healthcare is something that definitely comes on the top of the list. So
Obviously.
given your expertise in this area as well, so
Mm.
what are the key strategies you think that dental professionals should adopt to minimize risks in their practices? What would be your take on this?
Yeah, well, I would say, and for example, in endodontics, they are critical, like mostly in all surgery specialties. But okay, the first one is hand hygiene for sure. That is the first one for all. And we cannot forget PPP. The protection measures. Standard, like for example, even that the virus is not anymore around, we after the pandemic developed the insight that was there for years, that mostly our procedures are airborne, and that means that little viruses are in the air most of the times, with COVID or without COVID. So the necessity to use masks that are not the simple surgical mask, you have to use high protective masks for you and for the assistant, the dental assistant, and whoever is inside the room. That is not the patient, obviously, that you're working on. But for example, someone that is a familiar or relative that is there has to wear the mask too, and because it could be virus from the other patient before, if it was not enough ventilation, and because they remain in the air sometime. That is another thing. And the other thing that is really, really important is to do disinfection of and sterilization of the instrument that you're going to use, especially if you're going to use inside mucosa or a more like deeply like endodontic root canal treatments, And there is also too, I think, a lack in most of the quality because it's not a specialized measure to the instruments quality, for example. The time when you put them in autoclave, for example, how many times are you going to use these instruments? I know in United States, someone says one single use, but let's be honest, that's not happening here. So it's not like you buy one and you're going to use it with one patient. No, you use it several times, and that means like 10 or 9, but you're never sure it's going to last 10 sterilization, 9, 8, or you just look at, oh, it seems okay, use, and that's not really standardized, to be honest. So I think we need like a quality control of instruments specifically in dentistry. I think we don't have that to check, okay, this is single use. This is what manufacturer said. It's single use and we stay like that. Okay, so it's one use and goodbye. And it's that, it is a little harsh, but at the same time will change a little bit the price. Because if we are using one instrument that is very expensive for that specific patient, we cannot go for that charge as a dentist if we're paying the instrument. So that will also make a change too in the model business, because it will depend. Are you paying the instruments that you're using your patient? Is the clinic paying them? Is the clinic willing to pay more? That's another thing. But for sure, the patient has not to pay in health for that. And that we can agree. I think those three are the most important. And infections too, I want to add a fourth one, that is the antimicrobial resistance. The responsibility that we have as a dentist to keep prescribing antibiotics, because in dentistry, everything is empirical. We don't send like tests to the lab test to check, oh, tell me which bacteria is this one. That is not the normal, So empirical, we decide we're going to use we start with the first line, normally amoxicillin, right? And then we go. And standardization, unfortunately, in antibiotic is not worldwide. There are clinical recommendations and guidelines, but some differ from continent to other. For example, in United States, they almost withdraw clindamycin as a second option. As a prophylactic antibiotic, what is, help me, I forgot, the thing with for valvular risk, So now the thing is withdrawal now, and it's okay. It's been recommended, but with more caution than before, because of pseudomembranous colitis risk and all the struggles that had to produce. And now there is also the idea that maybe antimicrobial peptides could be a good option in the future, and probably laser therapy too as a coadjuvant. So we're seeing also that another things more than antibiotics could help, and I think we have to remain cautious with antibiotics. It's not that when infections are not being resoluted, it's not that we just put and give more, and we forgot the patient also could have another comorbidities, and we could make a very, very harm in the patient because of those mixed conditions that he could have, or she.
Right. I mean, those are very practical things that you said. And so we are almost at the concluding part of our conversation, though I don't want to let you go. But still, how do you, as such a multifaceted person, a professional with an experience in different facets, and you are doing outstanding work that you do. How do you envision the future of dental care in terms of technology, patient care, and definitely quality assurance?
Well, I have too much expectations, I have to say. But I am this way. I'm unconformist by nature. But I have to say that, for example, I envisioned aware with dentistry is part of like our cell phone in there. I envision that not regarding the brand that you wanted to use is available for you. And okay, you will willing to pay a service for calling a dentist. You could have an intro over a camera. You could have something that could help you to give some insight to the dentist, and obviously all secured by IPA guidelines, or he GRD, and if it's in Europe, whatever, even created in Latin America. It is not yet, but something like that. That there is a secure of data, but you can use it, especially for elderly. That is one point that is missing so much in terms of education, in terms of diagnostics, and in terms of monitoring, especially when they cannot move. And also the second population in kids, the ones that we can do prevention, before things start getting, especially importers are more poor, and they can, have knowledge. Yes, so that knowledge gives you a huge opportunity to do changes. If you don't know, you cannot change the behavior. So I embrace that, and I expect a lot of help, not as losing job, IA combined with robotics to do this blind work, I call, like, for example, that most of the endodontist has to do. Okay, you will be guided, but it's gonna be more accurate, because it's really insane when you think to do endodontics in a different tooth that have sometimes so complex anatomies. If you can see it in a scanner, you would understand. It's like a system of fluids going there, like there, and then you have this little line and straight, and you can have to, it's like dancing inside the tooth. It's really difficult. So I embrace our work in that. Technology is going to be involved, and also robotics. I expect to grow a lot, and I expect that probably in 5 years, when the spacecrafts start going to different places, the technology is enough developed to take astronauts to stay more time in different planets, as the way you can call it. I don't know either planets or exoplanets or whatever, but that if there is population to stay in those planets or exoplanets or in Mars, they can have dental assurance that nothing wrong will happen to them, And if something happens, that attention can be developed in that place with the help of the technology and a dentist that knows about. And I'm talking about some field that can go because of pressure or gravity trauma, dental trauma that can happen where there's no gravity, and for sure there's going to be a dental trauma over there, and things like that. And in quality, I expect that dentistry to be more included, because all what is quality in healthcare, I have to say, unfortunately, is only focused in medicine. And somehow we forgot that dentistry is part of the head is part of the body, the mouth is part of the body, and dentistry is part of medicine. And we cannot have only quality medicine and not be measuring the quality of the instrument, the quality of the dental materials that we are using, and expect that our treatments are qualified without not measuring those things before. We can measure the outcomes of the results, but we have to measure before what kind of instruments are we using. Are we doing it okay? Are the dental materials okay too? Not only to check how much it's gonna last, because normally what they do in clinics is say, okay, this is gonna last until 2024, okay. But there are more things to check, only that. There are more things to check. Is the right material? Is a good quality one? Is the one that is standardized? Is standardized for everyone. So I think we lack a lot of that. Are we gonna call the dental materials like dental device? As we don't have it, at least in here, as a device, as a medical device. So I think, I expect too much, okay? But I expect that.
No, I think that's wonderful points that you brought up, because as we move ahead with years, as science is developing so much, and with all the advanced technologies coming in, I'm sure somebody somewhere gets what you are trying to say through through this very jovial way how you explained it. But these are things which are really necessary and has to be called upon. It's not only region specific. I think when it comes to dentistry, it's almost similar scenario. In a global community perspective. So thank you, Andrea, for giving that fireside. It became a fireside chat, I think.
I'm sorry if I burned some things. It was
No,
not
no,
my
that's
intention.
wonderful. No, we need to speak what is what. I mean, that's I mean that should be there. I mean, we cannot keep all the things always very sweet. So that way it is fantastic insights that you gave. So just the last question and my favorite question is that. Uh, like we globally, if you see the part of education, particularly dental education, and a lot of students who are coming out who aspire, because this is not going to die anywhere. This is even going to grow day by day, and with the kind of flourishing of institutions in every part of the world. So it's a good time. So what would be your advice to young dentists who are stepping into the field, or who have maybe they are in their early career areas where what would be your advice to them so that they can really take this profession and take the services in a more holistic and more logical and more technology approach, and do good to the patients and do good to the society and definitely do good to themselves. Yeah.
Yeah, well, I could advise first, like, for example, if they're already in this, that they're already dentists, um, to make sure that they have at least 5 years of clinical work. Because sometimes it's easy, and I said this to every health worker, you have to be with patients at least 5 years to know what this profession is about. Okay, I'm not saying this that the person that did 1 year and then dedicate to another thing is okay, but you need to know how is to deal with patients, the day work, and then you can decide whatever you want to do. If you want to continue as a clinician, go ahead. If you have that, if you found that, okay, you did what you did in clinic and you think that you cannot grow anymore, you are free to go and search for other things, and somehow I think that the next generation will have to integrate a little more. If it's not in the education process, they will have to auto-educate themselves about systemic health, or do a continuing educations about that. And technology, if it's not offered in the university, unfortunately, we have to also do it yourself too, because if, as I say, we like it or not, AI is already here. Okay, so you have to learn how to manage the beast. Even if you don't, you're gonna stay behind. Like, you need to know at least how to understand, not to do the whole programming. Maybe you will have to do another career for that, but to understand what does do. And also in related to quality, and also related to, well, we they want to call human skills, normally called soft skills, to have management with people. But I think in all the whole care system, we need more human skills, like to really care, not only to be nice. To everybody can be nice, but when you really care, you're not doing a performance. You're being really caring. And I think that is needed in between colleagues to the patient to the healthcare, where it's a whole system and it's in relation and in every level, and from administrative level, clinical level. And I think that the more the dentists integrate that and understand, okay, it's not only the hospital where I have to integrate systemic. It's not only because I have a patient in urgency that needs to pull her teeth out because nobody did prevention that I'm integrating. Integration comes before in preventive. primary care, not in in tertiary care, you know? And that's what I think you have to ask. So dentists gonna have it very difficult, and the next generation will have to integrate a lot of things.
Thank you, Andrea. Thank you so much for all the insights that you have shared. I'm sure that this conversation, people, particularly the dental community, whether they are young dentists or whether they're already into the field doing very well, they will get a lot of useful information. And thank you, everybody, for being here and staying tuned with in this. Thank you, Andrea. Thank you.
Thank you for inviting me again, Gardy. I enjoyed it.
Yeah.